a table or to a flat surface, and right where that thumb touches that surface. And when we're on the clipboard, where the thumb there moves, so right on this edge here, right by the nail, is actually the part that we're going to use. So when we do walking with the thumb, it's an inchworm, so slowly, it's kind of like where the knuckle moves and you're moving up. So the knuckle should always be moving, and we're not using the pad of the thumb. Some reflexology do, but it can actually rip the skin away from your nail. So if you go to the side, it's a lot easier on your thumb. Then with the fingers, you're going to use 2 or 3, and again, it's a motion move on it. And usually when we do the feet, right now I'm showing you on the hands, but when we do the feet, it's a downward motion, and it's little, you're almost shimmying down, and so that you can do every little part of that skin on that toe or the foot or the hand or whatever part you're going to be doing. When we hook into a reflex, we're going to go in and then up. So in and up. You can go in and sideways or in and down, whatever way is comfortable. You do not want the nail to be able to be felt into the skin though. A compress is just pressing into the reflex. When it says light pinch, it's usually where the finger is bent and you are just lightly pinching on the reflex. A rub would use the palm and you're just doing a rub. A hand compress is with a bent hand, and when we're doing that, it's a motion. It's mostly the thumb here that's using the pressure. The fingers are just gliding behind. They're not really pinching. It's done mostly with the pad of the thumb. Okay, so when you bring your client into the room, and if they're into a reflexology chair or a lazy boy, or you can do it on a massage table where they're lying flat, you would just make sure that everything that you're using is clean, so clean sheets on massage table, pillow, blanket, whatever you're going to use there. On the chairs, of course, it would be towels. Setting up your station to have pads that you can use for the witch hazel to remove any dirt and to also clean the feet. So the witch hazel product, you can put it into a little bottle or you can keep it in its original. You can buy that at any grocery store. Lotion, so you need a cream to be able to use. Cream usually that we suggest is one that doesn't have any smells in it. Depending on your clients, they might have allergies, so make sure with the products that you're using that they're safe for your clients. And also you need a hand cleaner. If you're going to use one that is waterless, that's fine. That's what this one is. Or you can make sure that you washed your hand if you have a room with a sink in it. Just wash your hands prior to being with your clients. Kleenex is always handy to have for the clients too, so that just in case they need it. You're going to need, if you're going to use a chair, you're going to need 2 towels, or you can also have 1 towel and then the little booties that would keep the feet warm for the clients, and you just pop their foot in there because one foot's going to sit for a little while without being touched. Okay, so what you're going to do now is ask the client to remove their shoes, and then you're going to, if you're using a lazy boy, you're going to bring it up on a lazy boy. Once the person's in it, you can actually bring it up higher, and then your legs can actually fit underneath the footrest. And you're going to take one of your towels and you're going to put it underneath their feet. 2 reasons: one, to keep their feet clean, and also to help for not getting the chair dirty. You're going to take some hand cleaner put it on, clean your hands so that the client knows that you're clean. Now, rings and jewelry, a smooth ring or a band on a hand that is not your working hand. I'm right-handed. I don't wear rings on my right hand. I have found with the clients it's not a problem on the left. I wouldn't use a sharp ring there though. If you are going to have any on here though, you're going to be moving into their body, and you're going to be doing certain moves that rings can actually get in the way. So make sure that no rings can scratch a person, and also make sure that your nails have been trimmed. The major ones is your thumb, and also some of the finger movements going down. Again, you don't want to be able to scratch somebody, and they should not be able to feel your nails. If you do create a scratch and they bleed, they actually can sue you for that. So be careful. Your nails should be very smooth, and keep them shorter. So with it now, you're going to use witch hazel. Witch hazel is a natural product that helps to sanitize the feet. It also helps to heal the feet in case there's anything there too. And with it, it is a little bit cooler. Sometimes witch hazel has its own smell, so you can buy the product also with rose or lavender in it. Again, be careful that somebody is not reactive to those. Summertime, you're going to find that a lot of people feet are going to be a little bit dusty from probably open-toed shoes. That's quite normal. Clean both feet at the same time so that you don't have to interrupt the session once you've really started. You could also do a foot bath if you wanted to, and soak their feet for 3 to 5 minutes and have sanitizer in the bath. One of my students, it was quite wonderful. She had a bath and set up it like a real foot bath, and in the bottom she put a whole bunch of marbles, and it felt wonderful. With it though, you'd have to make sure that your marbles are always cleaned well. Okay, so once you have the feet, what you're going to do is just check them real quickly for any conditions that can be contracted with you touching them. So blisters, I always lift the foot, check underneath real lightly, and I usually tell the client just checking for blisters so that they know that's what I'm checking for. Checking then too, sometimes on the toenails, they have a fungus. A lot of people don't even realize it's a fungus. Sometimes tea tree can do it, where you just put a drop of tea tree on the toenail that has any infection or fungus, and it takes about 6 to 8 months to grow out, depending on which toe it is. Also too, the doctors have great medication that can get rid of funguses quite quickly. So depending, if tea tree doesn't work, and you'd know it in a month because you'd see the new growth coming out on the bottom of the nail by the skin, and you'd be able to see that coming up. With it, a fungus can cause problems in the future, so it is something that they want to look at. You guys aren't going to be touching the nails, so it isn't going to hurt you in any way. We're not filing them, we're not changing them, and we really don't run over them. What you might want to check for though is in between the toes, in case in the crease lines and that there is athlete's foot or plantar's warts. You can go on the internet, check out pictures for those conditions so that you know for sure what conditions are contagious. And that way there you do have a couple choices. You could put socks onto the client and then do the reflexology session, or you can put gloves on. Gloves I wouldn't suggest as much because then you're trying to work with them and you have sticky gloves. But if not, then you might have to send them to a podiatrist or a doctor and have their feet looked after. calluses and any of those kind of situations aren't really the problem. We just work over them. If they're tender, you just want to make sure your pressure is lighter. So again, you would mark down any markings that you have on any aspect of the feet so that it goes on your charting, and sometimes they mean something. It can mean that it's protecting the foot. It can kind of be the chicken and the egg, which came first, the sore or possibly the referral area in the body from the foot. It actually gets quite interesting once you get into this and start really sensing the feet, of how the conversation comes from the feet to you on what it's trying to tell you. Relaxation techniques that you have, solar plexus, right where the diaphragm is, and when you look at the diaphragm you can actually see the color on the foot itself, and so right in the middle you're going to feel a little soft spot there, and you can use either hand to do it, and what you can do is hook into it with the relaxation move at the very end of the massage portion. I love to do where you press in, have the person take a deep breath as they're breathing in and relaxing, and you do this 2 more times. Side friction, you're holding onto the foot and moving the foot. You're not actually rubbing your hands, you're moving the foot. And what you're doing is getting this foot ready, so we're waking it up, telling the brain, Kate, come down here, send the circulation. Okay, side friction is that one. Knuckle roll, usually like to do it with my hand that is my working hand. You're using the top knuckles. You can do it with the other one too, but you're going to walk up, always protect the foot, and then glide down. Walk up, glide down, protecting the foot so that I don't bend it backwards. My other hand is behind it, so that if I push with one hand this way, I actually am keeping it in place and gliding down. Dorsal and plantar stretch, holding just underneath the ankle. Again, it's the pad of my hand, pad of their foot. I am not bending their toes, I'm bending the pad, going towards them. Of course, it's to their ability, and then bringing it back, and it's just below the toes, and you do that 3 times. Circles, you're just moving the foot into circles. A lot of these relaxation techniques are from Swedish massage, so they're the same kind of techniques that are used in Swedish massage. Snowplow is where your fingers are in a V, and we're going to go on top of the foot. My thumb is just holding underneath, and we are walking down the metatarsals towards the ankle bone, and then gliding up. Walking down, gliding up. Butterfly, it's just the pad of the foot, so we're going to open the pad up and then close the pad so it looks like it's squished. Stretch it. And again, never pass their capabilities of their foot. Spinal twist on the medial side, the inside of the foot. It's where your hands are going to be together, and you're going to move one. And you're coming up, coming up. Thumb rubs, your thumbs are over top of each other, it's underneath, and you're just coming across. Sometimes be careful when you're doing the middle section of the plantar, because it can be soft skin and it can hurt people if you rub it too hard. Zone walking, you're walking all the zones, so you have the 5 zones coming down the foot, so you're walking in both vertically and horizontally. Again, you're just walking up the zones. Protect the foot at all times so you don't push too far back. Walking up, and you're going to do all the zones that way. And then you're also going to walk horizontally, so across. And you can switch hands. Get used to switching hands, because your right hand or your working hand, if you're a left-handed person, can get very sore after a while. So you want to be able to make sure that your thumb gets a break and your hands get a break also. Sweeping is just coming up. In Reiki or energy healing, people imagine a cosmic garbage can that they're putting any energy into that isn't needed. A twist is when you have a reflex, you can twist into it with your thumb or with your finger. And those are all your relaxation moves. So we're ready now for the reflexology technique. So again, you can use a towel or a booty. If you're going to use the towel, you just put it underneath their foot, and then what you can do is just put it over and wrap the big part around and just keep them warm. And then just place it to the side, and you're going to now start on their right foot. Or you can use the little booties and just slip them on. When I come into a client, I always put my hands onto close to the ankle there and wait a moment. Some clients, it takes a moment for their brain to register that somebody is touching their feet, and I don't want my clients to be ticklish. So if you have a client that's ticklish, put a little bit of pressure onto the foot and wait. And sometimes same with the bottom. Just put a little bit of pressure onto the foot and then wait. And then I give it just a little bit of a sweep or a rub to get them used to me. And then you're going to pick any 6 reflexology relaxation techniques that you'd like, just to get the foot warmed up and the brain to come in to say, you know, I'm coming in. So we're going to start on the big toe, and you're going to zone all the toes. The big toe usually takes me 3 sweeps. Because a toe is smaller, there is 5 zones. It might take 3, 4 sweeps. But because you do have all 5, you're going to work the zones. And then the little toes, you're going to follow through. Again, 2 or 3 zone walking on all the little toes. When you do the front, I always protect the toes with my thumb, and then you're going to just walk down, starting from underneath the nail, walking down ending on the little toe. The head, you've just zone walked all the toes, so you really have done the head, but now our intent is going to be onto the brain. And so we are going to just activate, and so you can either pivot your finger back and forth on all the toes. Again, protect the toes so that they can't move with your holding hand. You can also, if you wanted to, walk across. when you hook the pituitary, when you check your chart, you'll see where the toe pad is, and it's right in the middle. So you're doing your pituitary, the pineal, and the hypothalamus, and you're going to hook into it 3 times, or you could have twisted. Sinuses, again, I hold their toes. My fingers go over top of my own hand, so I can't pinch them too hard, and I'm coming up 3 times for sinuses underneath that pad. Hooking or twisting into the mouth reflex, and also the nose, light pinch for the teeth. That's on the bottom of the knuckle on all toes, so it's just a light pinch. Hooking into the thyroid and the tonsil on the big toe there. Intent onto the eyes, so twisting into the eyes, ears. You can move the toes apart to get into inner ear. Be careful, on some people it is very tender. Now moving into right plantar section, so the upper, and this section is just where the diaphragm is up to the toes. And you're going to first walk the neck ridge, so you can pull the toe pad down and get right into the ridge right between the upper plantar and the toes. Switch sides, walk again the other direction also. And you're doing this 3 times. Zone walking the entire upper plantar section. Again, always protect the foot so you're not bending it out of place. You never want to hurt your client. Again, you can change hands. You're going to do it vertically and horizontally. Walking the esophagus, so going right in between the big toe. Thymus. You can rub the lung area with the palm of the hand, and then do any relaxation technique that you like. Moving the foot again a little bit forward, so that, and never on the toes, just on the pad, and getting into the diaphragm line. Hooking or twisting into the solar plexus. Moving now into middle of the foot. So you're going to zone walk again the entire middle. So we're looking from the bottom of the heel up to the diaphragm, that whole section. Going to do it horizontally also. walking the liver reflex. You just did it, but now it's with intent. So now we are thinking about the liver reflex, and we're going to walk that. Walking the stomach and the pancreas. Hooking into the gallbladder or twisting. Compress the kidneys. Hook or twist into the adrenal. Bladder. Walking the small intestine. I always do the flexes first, so I do 3, walk up, flex, walk across, and then I walk across 2 more times. You can always feel where the stomach is if you run your finger down the lateral side, outside, and there's a little bump, and it's right underneath the bump. Straight across is the waistline. Rub the small intestine. Walking small intestine, so you're going to walk the whole entire section. You'll see there on your chart, lateral and vertically, or vertically and horizontally. Rub the foot. Hook or twist into the appendix, walking up the ascending colon, hook into hepatic, walking across the transverse colon, so this is the large intestine, and then I'm going to walk 2 more times the large intestine. Rub the foot. Lower section is from the heel. You'll see where it is. If you put their foot out, you'll actually see the color of their foot. So the heel area, so your hip and pelvis. So you're going to zone walk the entire section in both, or you're going to knuckle rub it. Hooking in to the sciatic. This is a real nerve. Everything else is a referred point. Sciatic is a real one. If you have a gentleman, you would do the testes and also the prostate. And you want to also walk the entire section for the ureter, bladder, uterus, ovaries, fallopian tube. You're now going to walk underneath the heel, and I go with a few fingers, and you're going to go halfway, glide down, change hands, go the other direction, glide down. Between the dorsal, walk chest, breast, and lung reflexes. So you're going to go down, and it's right from the toes to the ankle. You're walking between the metatarsals. You can also go across. Relaxation technique, the butterfly. snowplow is one of my favorites. So I walk down, glide up, walk down, glide up. Hook or twist into the lymphatic point right on the big toe. When you glide your finger down, you'll feel a little indentation between the metatarsals, and you just want to compress it 3 times. You can also hook or twist the lymphatic point. Walking across the groin lymph area, and you can do it with either finger. It's right where the foot bends at the ankle, and you're just going to walk across. Put your finger right into the point, right at the bend. There's a little indentation here. Put a finger there, and you're going to push the finger at the same time as pumping the foot. Somebody with any inflammation, this helps to let go of the liquid into the foot so it can all go back into the lymphatic system and be drained. The right lateral side, you're going to zone walk both horizontally and vertically. Do that with the fingers or with the thumb. Compress the ovaries. Always do the uterus on the medial side at the same time. Hand compress the sciatic. Walk the half moon, so it's 3rd finger, and you're walking around the ankle bone, gliding back. Walking around the ankle bone, gliding back. Light pinch for the arms and the legs. Reflex. So light pinch for the arms and leg reflex. And I always end with a sweep. Doing the medial side, you're going to walk the spinal. You can do that horizontally with 3 fingers, walking across the spinal reflex all the way to the toe. Your thumb, when you walk up, when you zone walk, when you get to here, you want to make sure that your upper hand is protecting that foot. 3 times is the normal amount. If you need to go more, that's fine. Rubbing the spinal column. And then that twist. And it's not the skin, it's actually the bone that you're trying to move a little bit. And it's only one hand that's really moving. Hook or twist into all the chakra points. And I finished with the last little sweep. And now you're going to change to the left foot. So you're going to take the towel, rewrap the other foot that we were just doing, and then do exactly the same onto the left foot. The left foot is exactly the same procedure as the right foot for the toes, the upper section of the plantar. Where you're going to find the difference is on the medial section. So you would now complete exactly the same on the toes and the upper plantar. And when you get down to the medial section, here you're going to find now that what you have is the transverse colon. So at the waistline, you're going to now finish off with the transverse. You're going to hook into the splenic flexure, and as you come down, getting into the sigmoid flexure, and then coming right out to rectum. So the large intestine comes across the waistline, down the lateral, and then down into some of the hip area. And you're going to do that 3 times. So that is the difference of the colon. The spleen reflex is different. So you have no gallbladder and liver on this side. We're doing spleen. Everything else is the same, lateral, dorsal, medial. It's only those differences on the middle section of the plantar. So you would continue to do the entire left foot, the same as we did with the right foot. And then imagine now that I have done the entire left foot. The next thing after we've completed it is to remove the towel, bring in the lotion, and you want quite a bit of lotion, and sometimes I put it on 2 or 3 times, also depending on how much time is left in the session. For the client, a session should be close to the hour. I warm it up first on their feet so they can get used to it, put some on both feet, and then I do some massaging. You can lift the client's pant leg up a little bit so that you can actually get into the massage of above the ankle. Some clients, if you like, you can bring their pant leg up closer to the knee, and then also give them a bit of a leg massage. I usually only work on the feet, and it's any type of effleurage, so any type of long, smooth, gliding motions. Once I've done both feet and given the massage, I hook into the solar plex reflex, have my client take a deep breath. I push in and release 2 more times. And we are done the reflexology session. Doing the massage, if you did know aromatherapy, you would have put it into your cream there and do it. Make sure though that you do have aromatherapy knowledge before you do it. There are so many essential oils that can actually harm a person. So make sure that you have that knowledge. After doing the massage, you would go and check any reflexes on the scale of 1 to 10 to see what they've changed to. A lot of times you'll find they disappear or go down. Over weeks, they definitely seem to disappear. And the ones that don't, you know that then are systems of the body that are healing and that need attention. After the session, I then help the client with their shoes. So you're going to put them back down. I usually always leave the towel onto the ground for them so that they can wipe their feet prior to putting on shoes. If it's summertime, sometimes it's very slippery, so sometimes I actually use the witch hazel to remove the cream off of their feet so that they don't go sliding. If they have socks and shoes, there are some clients that actually can't bend down. They're elderly and they just aren't that capable of ease with it, so I actually put their socks and shoes back on for them. and then you would go out and wash your own hands and complete any record entries at that time too. So once your client is finished and you've washed your hands, you've completed any records that you need, entries that you need on the forms, make sure that you offer your client water and that they drink lots of water afterwards, and you would then book your next appointment with your client. Reflexology, what you guys are going to want to do is take your hand sanitizer, and you would, both hands, and same with myself, have the client wash, because this way you don't have to use the witch hazel and the pads, and both the clients and yourself are clean. And so then it starts going the exact same rules as what you would have with the foot reflexology. So with this, now when I'm holding their hands and when I'm turning them, I cup their hand and then I'll turn them both ways. So I'm not just lifting them up and moving, I'm actually delicately, doing it. So when you are going to look at their hands for checking to see if there's any issues of warts or bruises or cuts or calluses or anything like that, that's what you're going to check for. So with it, I can also check to see for color. If the nails are quite a blue, it might be then their temperature. If also their hand temperature. With the temperature for them, if they have very, very, very cold hands, then I know their circulation isn't coming in. On with Teresa's, her knuckles are just a little bit red. With it, that's common on quite a few people, so that isn't something that you would necessarily, she might have just had like with lunch or something too, depending if the food changed, if you were gripping, so if somebody was stressed. There's other things too that can happen, but her hands are quite normal. Like that is quite a normal way. On the inside, too, some people might have very white, so if you're moving your hand and you see that it goes white to red, that's normal. It just means blood circulation is there. Okay, and she doesn't have any calluses or anything that I have to worry about. I'm just going to check the other one too. They're really itchy. Are they? They're a little warm. Yeah. Okay, so when you're going to start, you would start now the same way that you would with foot reflexology. So I'm going to turn it over, and I'm going to zone walk the hand. And the only difference is I'm going to do it with my fingers instead of my thumb. And I'm going to zone walk it down, and I'm going to do 2 at a time so that it just reaches it all together. Now, a person, if you want to, you can do them 2 or 3 times, depending how much time you have for your client. And if you're going to do a half-hour session, if you're going to do a full-hour session, or if you're just going to do a quick 10-minute, you would change of what you want to do. Okay, if I'm going to do all of the brain area, you would just come over each finger in individual. I'm supporting her fingers at all times so that I'm not hurting her in any way. Okay, your sinuses, again, you'd want to pinch you. So if I'm going to pull up on sinuses, and I'm going to come up onto her, like my thumb is protecting the first knuckle and then pulling up. Some people pinch, but then if she had any sores, then I don't know how much I'm pinching. So if I'm pinching me, then I'll know how much pressure I'm putting in. So with it, to do the other side, if you're going to zone walk the other side, you just do the same. Now hands naturally have a cupping effect, so she just has her hands over top of mine, so it's just kind of cupping. And then I can protect her knuckles because I don't want to do the knuckles the opposite direction. You can do relaxation techniques. So with it, at any time that you feel that you need to do a relaxation technique, just add it in. Nice one is a knuckle rub. You can also do your thumb rubs too on them. You could go across like you would on the foot. Okay, so now if you're going to start doing all the points, now your thumb is just like your big toe. So you have your mouth and your nose, the pineal, which would be on the inside. You would have the pituitary. Now the interesting thing, and you can usually see it on the thumbs, is if you look at your thumb, they say where the swirl goes, right in the very middle, where that swirl tip is a lot of people where the pituitary is. You're going to get into the hypothalamus. Again, usually the trigger's 3 times. You can come and do your thyroid and your tonsils. Again with the eyes and the ears. Inner ear, just do it lightly just in case, so just straight in between. And again, at any time that you want to, you can add in relaxation techniques. Now, doing the shoulders, so right up and top, you're just coming in, right in to where the hand joins, so right in where the meat is here. And I'm really wanting to go down into her hand, not up into the fingers. And I'm just walking it. Is pressure okay? And then you can relax it out too. Now the teeth, so on the bottom of the knuckle closer to the hand are your bottom teeth, and then your top teeth, and it's just a light pinch on all of them. When we do the feet, we usually do the upper, the middle, and the bottom plantar. But when we do the hands, because there's not a lot of space in here, you're going to zone walk it all together. And again, you can do it with 2 or 3 fingers. And you're just coming down. Again, pressure okay? Mm-hmm. You can also come across. Again, make sure that your nails aren't too long because you don't want to get right in them. Then you would turn your hand over. And here, if you want, I can use my knee. If the pillow was on top of a table, then they'd have their own weight and I wouldn't have to worry about it. But being that it's on my leg, so if I was just out in the open and I didn't have a table somewhere to use, I would have the pillow over top of though if I did, and then still the towel over top of that for comfort. But if I wasn't, I could do it in my lap if I had to. And this way I'll put my knee underneath to kind of use it as support, and then if you want you can do the snowplow. So in the upper part here, what we're going to do then is you do have your triggers, because we've zone walked it all both ways. So really we've done everything. So your triggers then would be the same as what they are in the feet. Now the only difference is where they're placed. So what you'd have is your kidneys, and you would hook it 3 times. Your adrenals are just above the kidneys. In your right hand, you would have your liver, and your liver would be kind of more underneath the little finger. And so you can get into there, and mostly what I get into is there's a crevice, like a little, right between the metacarpals, you would have like an indent, and so you'll feel it in a person, and so then you can trigger into it 3 times. Now, when you're going to walk the large intestine, with this one, if you want to walk with it, you'd have to come up, and I thumb walk it, come across to the waist, which is about mid of the hand. And so if you want to walk it 3 times, you can, and that way you've also triggered all the flexures. Now, if the kidney goes the opposite direction, if you want to walk with the bladder, with the ureters, comes down and around, and then your bladder just sits pretty much right on the bottom of where your thumb is there. You can trigger it 3 times. And again, relaxation anywhere that you'd like. Okay. Your sciatic is also down just a little bit further in the uterus. On the other side would be the ovaries. If it was a gentleman, it would be the testes and the prostrate. So pinky would be the testes, and big thumb would be the prostrate. To do the rectum, some people do a sweep, so you can come up the arm to do the rectum. You can also walk it if you'd like. So it depends which you're going to feel is better. Turning the hand over. Okay, so in here what you have left is your groin and fallopian tubes, lymphatic area, right where the hand bends. So you'll feel a soft spot in here. You're just going to finger walk across, finger walk across. If you do your edema spot, same as like with your ankle, you find the soft spot right where the hand is, and you can pump it. So just the same. Okay, coming down the arms and the legs. Is it with that? Okay with that one? So you're coming down. Now, if you're going to do the spinal column, you're doing the thumb. So I'm coming down. I like going the whole thumb all the way down back to the wrist. So you're doing the spinal column all the way down. Plus you can go across. Your lymphatic point to drain, right at the base, just like on the big toe. There's a soft spot right where the bones meet, and so then you can compress it 3 times for the lymphatic point. It's okay. And on the front, like on the front here, we had already done it with the snow plow, but it's a chest, breast, and rib cage, lungs. Okay, so you would change your chair over to match the other side. I usually literally move myself from the right hand to the left. Now for the video, we actually switched it, but
so
normally
you would just go over here.
I would just move my chair right over, yeah. So now you would do the same thing that you just did with the right hand. You would zone walk. So you're zone walking all the fingers. And there's no real reason that you couldn't start with the big thumb. Like, it's just whatever you consider. And again, you can do it a few times with each, whatever you have time for. Pressure should be just enough that they can feel it, but not where it's major pain. And it's going to feel different on them with their hands, because there's a lot of sensors in their hands. And then just cup their hand every time you turn it. And you want to make sure you get all the zones. Yeah, just to the shoulder ridge there. And you can put relaxation anytime in it. And anyone's. Slightly hold their fingers and do the brain reflex over top of each one. And we're just holding their fingers to support them. If you're going to do the sinus, you're just pulling up on the pad, so you're really just pulling up, and you're just supporting so that you're kind of pinching you as you're doing them. Okay, so as we're moving down now, you can do your thumb if you like. So it's the mouth. You're going to hook into the mouth, the nose. On the opposite side is the pineal. If you're doing left hand, to get into the hypothalamus, you have to use your other hand usually. Pituitary, right in the middle of the thumb, and you're hooking in 3 times. Tonsils, thyroid. So you're going, then you have your eyes, ears, inner ear. This is right in between. Just be careful on some people, it might be really tender. Teeth, just a light pinch, upper and lower of the knuckle. Same with the thumb. Okay. Now, moving down again, you're going to zone walk. I like using 3 fingers, but you're going to zone walk all the way down the palm of the hand. A person could use your thumb, it's just a lot easier using your fingers with the hands. You can also come across. So you're doing your vertical and your horizontal. And then whatever relaxation techniques that you like. Here now you're going to do the shoulders, so just support their fingers so that so my underneath hand is supporting their fingers so I can walk that shoulder ridge. Relaxation again of whatever you like. Now in here with being the left hand, again you're going to have the kidneys, so you can get right into the kidneys and hook it 3 times. And the adrenals, just up a little further. Now on the opposite side, what you have here though is the spleen. So you're going to hook the spleen 3 times. Now walking the intestine here kind of goes in a kind of a curve with it. So depending which hand that you want to do, you can do both. And what you also have is from your kidneys, you have the ureter going all the way over to the bladder, hooking the bladder 3 times. Either side of the wrist, you have either the testes and ovaries or the prostate and the uterus. down just a little bit lower on the pinky side there, you have the sciatic. Again, you can do either the walking of the rectum. So the rectum, you can do the sweep or the walking, whatever you like. From here too, if you want, I usually switch over to now do the, again with my knee, I'm just protecting the hand, and then I'm going to snow plow down. And then on the wrist is the groin lymphatic fallopian tubes. Again, I'm going to find the edema point, which is a soft spot right in the wrist where it bends, and now I can pump the hand while I push the edema. And relax it. Turning the hand back over, I can do the arms and the legs. With the thumb, just make sure it's protected too. I can do the spinal column all the way down. And also the other way, so you're doing it vertically and horizontally. You really only have to do to the first joint. I like going all the way up. Okay. So once you're at that point, then what you have now is the cream. Once you have the cream, a lot of times I warm it up with my hands, and then I ask for both hands. Put it in. I just kind of start mixing it on both. Don't worry, that's why you have the towel there. And then you can start with one hand and start to rub it in. This thing that you would do is right where the diaphragm is, you would take the solar plex area, ask them to take a deep breath. Okay, take another deep breath. So you push in. When they exhale, you're letting go. Take another deep breath.